Dr. Jaffe, one of our customers is doing some research and would like for you to weigh in because he knows you are the expert on this. Would you please make some recommendations for the treatment of the COVID long hauler symptoms? You know, of course, using PERQUE Nutraceuticals.
Thank you for the question. It's a question that will gain much more interest as this kind of research is translated into action, shall I say. And let me start with the conclusion and then briefly explain what the article in question points to. The article points to the fact that healthy methylation is essential for being well, for recovering from any infection, especially an RNA virus like COVID. And what this team reports is something we hypothesized and addressed, which is what's called the one carbon cycle, also known as methylation. It has to do with serine, an amino acid. It has to do with methionine, a sulfur-containing amino acid. It has to do with glutathione, and it has to do with homocysteine, among other biochemical constituents. And yes, I'm a biochemist. I could go on for a long time about all the interdependent relationships, but let me be brief. Methylation, when it is healthy, supports translation of DNA to RNA to protein to healthy products. And there's a quality control step where if you have healthy methylation, that process of transcription and translation and whatever is involved is very efficient. More than 95% of the products pass quality control. But if methylation is impaired, if you drive methylation by supplementation with unnatural pharmacologic agents, you can easily get hypermethylation. And there are dietary and other stress-related reasons why people can have too little of these markers, amino acids and peptides. And what you want to do is restore healthy methylation through healthy serine to glycine, where the kidney takes glycine, if it's available, and converts it into serine so that it's available for this one carbon methylation cycle. That's a good thing. If you have impaired kidney function measured by glomerular filtration rate or BUN to creatinine ratio, or however you measure kidney function, impairment of kidney function impairs that process of glycine to serine availability. There's about 4 grams a day that a healthy kidney or pair of kidneys will take and convert to serine throughout the day. So that makes serine a very important intermediate. But it also means we need a lot of it. So we need the biochemistry, the cellular chemistry, to advantage us in regard to converting, having glycine available to convert to serine without having a glycine deficiency, because glycine is a beneficial neurochemical. Glycine is a very simple amino acid, but surprisingly, people can run out of it. And our amino acid PERQUE Mood Guard takes advantage of the fact that we understand the functional chemistry of higher purity forms and synergies of benefits of amino acids, and we recommend that. We also recommend PERQUE Sleep Guard for those who want more restorative sleep, and maybe our suggestions of how to achieve restorative sleep through green dichromatic light, abdominal breathing, stretching, salt and soda baths, and other ways of transitioning from the challenges of the day to the opportunities of sleep. So there's lots to the question of methylation. We have been among those who for decades have pointed out that healthy methylation For example, the use of nature's B12 hydroxycobalamin. For example, if you look at our super multi, the PERQUE Lifeguard Tabsules Mini and Maxi, the tabsules that we developed back in the late 80s contain many of the things that are synergistic with what the questioner raises, and we're glad to communicate. We're glad to let the world know that we're on the issue of healthy methylation using nature's forms of nutrients in balance based on the individual need. This is for personalized, proactive, predictive primary prevention practice and protocols. And please contact us if you want to know more about how to achieve healthy methylation in a time of pandemic. Thanks.